Namaste. Today is the World Health Workers Day. All over the world, people are, celebrating as a special day for dedicating to all our health workers, doctors, nurses, lab technicians, and all other people who are involved in the health working, even the people who are involved in cleaning, all the workers. We give a big salute to all of them. We are going through a very difficult times in the history of the world. It is in this time we are trying to, evaluate and dedicate the service of the health people involved in the health field, very especially at the time of this coronavirus war. It's really a war, a third world war, a war against virus, corona 19. If you are not subscribed our channel, you can do so. The health workers I describe the work, the service of the health workers in three words: brave, courageous, and sacrificial. They are sacrificing their life. They are very brave, very courageous, and sacrificing in nature. Health workers undergo three types of hazardous situation. First of all, it's a biological one. So many patients with serious sicknesses come to them. Very serious sicknesses. The sicknesses that can spread by touching, by keeping proximity to the patient, like coronavirus, TB, and there are many other sicknesses which spreads by their proximity, but they are still available for the patients. Secondly, they also face a physical problem, physical hazardous, like when a patient they are treating, they treat with all honesty, with all dedication. They are treating the patient. Suppose in case the patient does not cure or loses life, they have to face a lot of problems, at times even physical harming. It's an issue many of the doctors face at least sometime in their life. Health workers face such situations very often. They also have a sort of psychological and social issue. That is, very especially during this time, they are quite away from their family. They are very sure this treating this coronavirus patient, they can also get affected, because coronavirus doesn't see whether it's a doctor, whether it's a nurse, whether it's a non-professional, any person can be get affected. So they have to keep an equal distance. At the same time, they have to treat a sort of mental agony. And their family is also keeping them away. And doctors personally also prefer themselves to be away from the family. Adding to this, when an emergency comes, be it a doctor, be it a nurse, or be it anybody, the health professional is immediately called up. They have no duty time, 24 hours available for the patients, because they are given the duty to save the life. Saving the life is their duty. So they are involved in all this. They forget that they have a personal life. They have a family life. They are all the time dedicated to the service of the people. And many of these doctors who are treating these corona patients, or the nurses treating, many people do not even like to go near them. People try to keep away from them. A lot of isolation they face from their own close people, from the people other side. A lot of isolation they face. And many of the health workers may not be getting so much of testing facility because they are always involved or in treating the other people. Their target is keeping the community. They do not involve themselves or include themselves into the category of the people. They are away from the people. Therefore, they do not get much opportunity for testing. And many of them we see during this coronavirus time is not going home at all. They are staying away from home. They are staying away from their most important responsibilities. I bring before you some of such doctors and such people. Dr. Silawat. See, Dr. Silawat. This doctor got information. The mother is expired, but she did not leave the hospital. She did not leave the hospital. She found it is more important to treat the patients than going home. She did not go. She remained in the hospital treating patients. See the responsibility she had. Another is a doctor, Dr. Sachin. 7 days he has not gone home. Dr. Sachin has not gone home. Dr. Sachin made a vehicle, his own vehicle, as a home. And it is parked in the hospital campus. He has brought all the necessary things in the vehicle itself. He sleeps there only. Every arrangement is made in the vehicle. Another doctor is, Dr. Saurabh. He has not gone home for the last 8 days. What these doctors are telling us, the community is more important for them. Their duty is more important to them. Then we must also know Bhosle, Minal Bhosle. The lady, Dr. Minal, the lady who showed first that the duty comes, second everything. And you know what was her duty to be done? Give a child, a new baby to the world. Gifting a life to the world, that was her duty. But she took time even from their delivery time, she took time to make the first homemade kit in the country to test corona positive cases. She was very brave. She did not go home, did not get admitted in the hospital till the final testing and approval was done for her coronavirus testing kit. And the second, I would also introduce 3 doctors. Dr. Nagaraj from Tamil Nadu, Dr. Sanjeev Jain, Dr. Deepthi Chaurasya. See, these are all working in the biology department. They are in the technical side, testing all the blood samples or the swab sample coming to them. They are trying to test and give the result as early as possible. They have not gone to their home for the last many days. They are staying in the hospital and doing their duty. That's the reason I told in the beginning, we need to salute these people. The doctors who are dedicating their service for the nation. We need to salute these people. It is our duty. They have left their home, left their family, left their friends, everything, and dedicating their service to the nation. To every people in the country, to every citizen in the country to have a better health. I thank all the doctors, nurses, technicians, even the people involved in cleaning the hospitals, health facility, everybody. A big salute to them and a big namaste to them. Thank you very much for the services that you are rendering to us. All doctors or health professions, we are very happy